So this is one of my favorite ways to measure knee flexion because you're sitting, you're comfortable, as opposed to laying flat on her back, which, have you laid flat on your back?
Mm-hmm.
Can you? Does it bother your back at all?
If I lay there very long.
Yeah. So go ahead and put your foot up on here. What's nice about this too is this kind of acts like a wheel. It allows her to slide her heel back. Now, depending on her range, if she starts to touch there, I'll have her scoot her bottom forward a little bit. What do you feel at that point?
Pull right through here.
Okay. Do you feel any stretch on the front? Mm-hmm. So when she's feeling behind the knee, there's really two things that she could be feeling. One is she could be compressing like a bursa, if she has a Baker's cyst or something like that. Or she's feeling her hamstring just trying to pull her knee back. Neither one of those is necessarily dangerous. And because you don't feel the stretch in the front, we have more range of motion in there. So let's do this. Let this come down. Just let that relax a little bit. I'm just going to pull this up so we have a little slack. Like these jeans are pretty stretchy, so it shouldn't be too bad. Your goal, what I want you to try and do for me, let's go again, is I want you to try and slide this back till it touches that. And then once you get there, I'll take a measurement. Perfect. Now what do you feel at that point?
This hurts through this and right to here is mostly.
So that's what we're looking for. I'm looking for her to feel sensation in the front, because now that's telling me we're running out of room in the front. Pinching, compressing, muscle pain in the back, that doesn't mean that we're out of range of motion. And then if I get a quick measure. Do you remember where you were before, range of motion wise? So we're at 107, right there.
More than that.
We're not at the end range. You have more range. This is blocking you for now. So let's let this relax a second. Slouch a little bit for me. Slide your bottom forward 2-3 inches. There you go. And then let's go back into that position. You can put this one up in the same position. So if I put the non-surgical leg up, it kind of helps reinforce the surgical leg.
And right there as far as I can go.
And so what do you feel? Where do you feel it?
Most of it's right through here.
So again, like that's consistent. Whatever's going on the back of the knee is not scar tissue. It's not tightness in the joint capsule. It's not any of the connective tissue restriction. Just try to relax. Don't push it anymore. Just leave it there and give it a little shake.
I mean, it pulls. You can feel it. But
Right.
Most of the pain's here.
That's fine. So what I'm going to do is I'm going to give her a little anterior pressure at the top of the calf just to relieve some of the pinching that's going on behind the knee. Now she has a lot of sensitivity around that fibular head and the lateral knee, so that's a component also that might be restricting the flexion.
And that Baker's cyst is coming back.
Yeah, I mean, but it's not a bad thing. A Baker's cyst is just a pocket of fluid in the back of the knee. It's not uncommon, it's not unusual, it doesn't mean that there's a problem. So what I'm doing here is I'm kind of giving her a little pressure at the foot while I'm pulling forward at the top of the back of the lower leg bone, the tibia.
Now I'm feeling across the top of this now.
That's what we want. That's where we want the stretch to be. Now let me get one more measurement and then I'll give you a break. So now we're sitting at 117. Okay, 117, 120 being the goal. So now that we stretched it, now she's going to exercise it. So let's go ahead and put your legs in between the cushions. You can scoot back and then just go ahead and give me 20 kicks. All right, thank you.
I didn't know where he stopped. Okay, I didn't want to delete the video.